Hi there, and welcome to Tooth Be Told, your inside look at the PerioVive training team. In each episode, we explore who we are, what we do, and the powerful role that hyaluronic acid plays in advancing patient care. Today, we're thrilled to have Tracey Arrison, a veterinary technician specialist in dentistry. Welcome, Tracey. It's great to have you here.
Thank you so much. I appreciate the invite, and I'm happy to share my study with you guys today.
Amazing. Well, let's get started with just a little bit about yourself. Tell us about yourself, your training, your current roles, all of that good stuff.
Okay. So, just like Candace, I come from the 1900s. I've been in animal medicine for about 28 years. And I started as a contextionist, like so many of us did, and a single doctor practice, kennel technician and receptionist. So, it wasn't long before I knew technician was going to be my niche and dentistry shortly after that. So, I've spent the better part of 20 years focused just on dentistry. I've only ever worked in general practice. So when people ask me, can you get your VTS in general practice? Absolutely, you can. It's a little bit more challenging, but it's worth it because I feel like you just benefit a little bit more and you get to play a larger role in veterinary dentistry as a whole. So I currently have lots of hats. I work in an NVA clinic in Panama City Beach, Florida, and I am a traveling dental educator. So I go all over teaching dentistry lectures and workshops and clinics and universities all over. And so it's good. I love it, and I love dentistry.
Amazing. Amazing. Well, you're a busy girl then. You've got lots going on, lots of traveling and lots of responsibilities.
Yes.
So tell me what initially drew you specifically to dentistry and more specifically towards pursuing a VTS.
So I love animal dentistry, which I just stated, but I truly believe that we offer so many benefits to our patients when we perform a dental cleaning or oral surgery. Not only are we helping them feel better by removing a source of pain and infection, but we're probably helping them in ways that we don't even know. I can't tell you the number of rechecks I've done, and owners will come back and just say that they're just feeling better, they're acting better, they have more energy, they're playing with a toy they hadn't played with in a couple years. And that just, makes you feel good that you had a role in making this pet feel better and helping the owner really understand the ramifications of oral disease and how we can help and how we can benefit by continuing yearly anesthesia dentistry and keeping that mouth clean and healthy. Get a clean, healthy pet.
That's right. Amazing. Well, and I agree with you completely. I think that that was always one of my favorite parts of practice was those rechecks when they said, I didn't realize anything was wrong, but now my dog's acting like a puppy again. And it's so rewarding because they don't tell us that they're suffering and we get to help. So, yeah.
Absolutely. I
I
agree. And so you had asked about my VTS. So the more procedures I helped with and the more surgery and dentistry that I learned, the more I wanted to learn. So my entire goal was always to be a VTS. And so once I got my degree and credentialed in the state of Louisiana, I immediately started logging my cases and counting the years before I could apply to the AVDT program, just to get that next notch on my belt because I always wanted to be a VTS. And I've been one for about 10 years now, and I don't regret a single day of it. I'm still learning. I still learn something every day, and I love it. There's just so much to know and learn and continue to learn.
Wonderful. Well, thanks for sharing all of that with us, Tracy. Next up, I think we're going to talk about this article that you read, and I'm just going to read the title here for us. So, the efficacy of topical 0.2% hyaluronic acid gel on recurrent oral ulcers, comparison between recurrent aphthous ulcers and the oral ulcers of Behçet's disease, written by Lee and published in 2008. Does that sound like the right article?
It sure does.
Okay, good.
It
And
sure
am I
does.
pronouncing Behçet's correctly? Is that how you pronounce it?
So I think it's Beset's, but I'm not
Behçet.
positive. That's how
Okay.
a human physician pronounced it to me was Beset's. So
Okay. Well, see, I'm learning something new already. All right. Well, for all of our listeners, can you briefly summarize the study design and just the purpose of the article?
Yes, so this study was in reference to oral inflammatory conditions, and it was published in the Journal of European Academy of Dermatology and Venereology. And it basically compared two groups of patients, those with recurrent aphthous ulcers and those with Behçet's disease. And of course, both these human diseases are characterized by painful oral ulcers, similar to that what we see in veterinary stomatitis cases, the CCUS and the FCGS cases that we see in our cats and dogs. But this study offered two types of assessment: subjective, as reported by the patient, and objective, as reported by the physician. So the subjective assessment included the number of ulcers, healing period in days, and the visual analog scale pain score. VAS pain score. The objective assessment looked at the number of ulcers, maximum size of ulceration, the overall response of treatment, along with inflammatory markers such as redness, local heat, and swelling. So it looked at a lot of things, but basically it was a 14-day study with topical application of 0.2% hyaluronic acid, which you had mentioned, and it was a twice daily application of that directly on the lesions in the mouth.
All right. Yeah, so they looked at a lot, and it was a 14-day study. Is that what you described?
Yes, just a
Okay.
14-day study, and the results were phenomenal.
Okay, well, with that said, tell me what the key findings were that stood out to you the most.
Okay, so bear with me because it's a lot of numbers, so I'm going to look at my notes here. But the results showed improvements pre and post treatment in both subjective and objective assessments. And on average, the number of ulcers per week was reduced by 72% in all the patients. A decrease in healing time was noted in all patients by 72.7%. And 75.8% of the patients reported a decrease in pain and the VAS pain score. That was the subjective assessment. Now, the physicians reported reduction in the number of ulcers by 57.6%. And the patients, in all the patients, and 78.8% showed a reduction in surface area of ulceration. So the lesions themselves reduced. And also all parameters showed improvement after 2 weeks as far as localized heat, the inflammatory markers, the heat, the redness, and the localized swelling. So all of the parameters that were looked at did show improvement with that placement of hyaluronic acid, which is phenomenal.
Yeah, those are big numbers. Those are dramatic
Yes,
findings, aren't they?
significant numbers, absolutely.
Yeah, and I think something else that I that was striking to me was that there were no side effects. And, the current standard of care for these conditions, to my knowledge, is steroid therapy, which isn't always a benign treatment. So if we can use something like hyaluronic acid where there are no side effects and we're seeing such dramatic results, I think that that's pretty cool.
That is pretty cool. And hyaluronic acid, of course, is a naturally occurring polymer, and it's found in all humans, animals, and in some fruits and vegetables, even. So it got discovered in 1934, and it has been just studied at length since then. It's found in a variety of medicines. We even use it in other aspects of veterinary medicine, and it's in many areas of human medicine. Burn units, it's really cool.
Yeah, yeah, absolutely. I agree with you. So a little bit, let's see here. I'm going to pull up my notes here because I want to read off some of these stats that you just described to us. But this study, it found that the patients using the hyaluronic acid gel experienced, as you described, reductions in pain, ulcer size, healing time. And I just wanted to read those numbers again. So it looks like 73% of patients reported fewer ulcers and faster healing. And by decreased ulcer healing time, I mean healing times dropped in half from 14 days to 7 days, which is incredible. 76% reported pain reduction. Ulcer area shrank in 79% of patients. So I just wanted to ask you, Tracey, which of these outcomes do you find the most clinically meaningful and why? You
Good question.
go.
So hyaluronic acid, the application of that immediately reduced the ulcer pain and discomfort, like you just mentioned. It is a naturally occurring polymer, which we've already talked about, and it's been widely used in human medicine. It offers anti-inflammatory properties, anti-edematous effects. It has wound healing stimulation, and it is an extracellular constituent of connective tissue. And what that means, it makes it a really beneficial component of wound healing and tissue repair, especially in the oral cavity, which this study also proves. And that's why PerioVive has been proven so effective and efficacious in the patients thus far.
Yeah, I agree with you. I think that that reduction in pain really was striking to me. I think to your point with these hyaluronic acid gels and PerioVive, if we can, I think besides just that tissue regeneration and that anti-inflammatory effect, that analgesic effect is so exciting to me. I think if we can provide just one more path to pain control and speed healing, all with a product that has no side effects, why wouldn't we offer this to our veterinary patients? So,
Absolutely, absolutely. And veterinarians often borrow research results from human studies, especially in areas where minimal data, such as a study like this. It offers so much helpful data for those challenging veterinary oral inflammatory conditions like stomatitis, like you just stated.
yeah, absolutely. Okay, Tracey. Well, with all of that said, given this favorable safety profile that we've talked about, where do you see topical hyaluronic acid fitting into our current oral wound management protocols?
These results suggest that hyaluronic acid will be beneficial, especially when used in those oral inflammatory conditions in our veterinary patients. We're in fact seeing such results in our early ongoing research in feline chronic gingivostomatitis and canine chronic ulcerative stomatitis. So I feel like this is a product that hyaluronic acid will prove to be beneficial in situations like this, in cases like this.
Wonderful. Well, anything else, Tracey, that you want to add about this paper? I think, we talked about how dramatic the results were, and, if we can provide that comfort with no side effects for our patients, it's a pretty cool product and a pretty cool finding. Anything else you'd like to mention today?
No, I believe that's it. I think we've covered it. It was a really interesting and beneficial study, and I know that these results will prove to be really important in veterinary medicine.
Yeah, I agree with you. Okay, Tracey. Well, thank you so much for joining us today and for sharing your expertise. It's been a pleasure learning from you. And thank you to our listeners for tuning in to Tooth Be Told. If you're passionate about veterinary dentistry, don't forget to check out more episodes and resources on periovive.com. Take care, and we'll see you next time.